Hey folks, YouTube world, we're going to try something different. We're going to try recording me recording the podcast. So there may be some dead spots. I don't know. This is a total experiment. Come along for the ride. You like the glasses? I hate glasses, but you know, at my age, it's a must. So here we go. You ready? Hey, today we're going to talk about our blessing and America's curse. Yes, opioids. That's what we're talking about. Now, why would I ever call opioids a blessing? We'll get to that. Stick around for some updated info on how evidence-based chiropractic can absolutely save the day. But first, how about that bumper music, huh? Okay, we're back. Welcome to the podcast today. I am Dr. Jeff Williams, and I'm your host of the Chiropractic Forward podcast. Now that I have you here, I don't even know what I'm trying to say. Now that I have you here, I want to ask you to go to chiropracticforward.com. Sign up for the newsletter. I'm telling you, it makes it easier to let you know when the newest episode goes live. When someone new signs up, it makes my heart just leap a little. And you know what? In the end, it's just polite. I work hard. It's just nice of you. We're polite here in the South, so I sure would appreciate it. We're really starting to pick up some steam here on the Chiropractic Forward podcast. Thank you to all of you that have been tuning in. And if you can share us with your network and give us some pretty sweet reviews on iTunes, folks, that would be nice. I will be forever grateful. By now, we all know how the interwebs work, right? You know how this stuff works. You have to share and participate in a page. You have to do those things if you're going to see the posts or if the page is ever going to be able to grow. So we need your help. Just do it. Just do it. Okay, we are honored to have you listening, and here we go with some real vital information that we think can help build confidence and should be able to help you improve your practice, which we think is going to help you improve your life overall. You have Texas two-stepped your way into episode number 32. As I was wondering, what the heck am I going to talk about this week, I started looking at having a guest. I had a great one in mind, and it didn't work out. You know, it just didn't. He was unavailable for a few weeks. So I was like, well, now what? What am I going to do? Because I already was going down one track. And I started to put some random research papers together for this week's episode. And I was trying to gather my thoughts on flow, order, you know, all that good stuff. And then poof, shazam, wow, bam. It was like divine intervention, like a lightning bolt. In my email box came 4 to 5 articles all at once, like on the same day, in the same hour. It was pretty much crazy, if you can believe what I'm telling you, and you should, because I always tell you the truth. And I'm not one to poo-poo blessings or to throw rocks at divine intervention. I follow the path that is put in front of me when it comes in that sort of form. So guess what? We're going with opioids. It's just going to happen. And we're going to go with the ways that evidence-based chiropractic can help save the day by helping our patients avoid opioids. Now, if you've been following this Chiropractic Forward podcast for any amount of time, really, or have seen any TV news program, you'll know that America and the world has a bit of an opioid crisis, and chiropractic is absolutely, or can be absolutely, in the driver's seat of alternative interventions that have been proven effective in treating the conditions that opioids have commonly been prescribed for. And I want to start with an article I received from my malpractice carrier. And since I use the largest of chiropractic malpractice carriers, I'm guessing you all got it too. Well, at least a majority of you. And if you're like I used to be, and if you're like most chiropractors still are, you just deleted it rather than reading the stupid thing. And it turns out that I'm a bit of a nerd. Happens. I'm a bit of a nerd. And I actually read the thing. It was titled Opioids, Misuse and Addiction, How Chiropractic Can Help. It was written by Christina Petrocco-Napoli. Good names right there. And posted on a site called Clinical Risks. And it was posted on June 13th of 2018. I got it cited in the show notes, so go check it out. The article started with a story about Megan. Megan was in her mid-30s, and she was suffering from chronic pain, and she'd been suffering for like 4 years, and it was all started by a wreck she had 4 years ago. Now, as we chiropractors are well aware of, evidence-based chiropractic care was not offered to her as a viable option for treatment following that car wreck. Of course not, right? Frustrating. I mean, you know, the trauma is mechanical in nature, right? So why recommend mechanical solutions? Why do things that make sense? Let's just go right to the historically ineffective addictive chemical treatment instead. I mean, because that makes more sense, right? No, it doesn't. It really doesn't make more sense. So basically, Megan went through 2 pregnancies addicted to opioids. Ooh, tough stuff. She had a little bit of success quitting during different parts of the pregnancies, but she just continued returning to opioids. And you know, in this article, the author goes on to cite information from the American Academy of Pain Management that says 100 million Americans suffer from chronic pain. And let's just think about that for a sec, okay? 100 million Americans. Well, the last time I checked, America had a population of about 320 million Americans, if I remember right. So 100 million of 320 million, that's like one third of the nation right now is suffering from some form of chronic pain. That's just terrible news, absolutely terrible. But I'd argue it's actually great news for chiropractors. I mean, I hate to think that way, but it's like, you know, if you see personal injury patients in your office, well, I mean, we don't really want people out there getting into wrecks, right? I mean, that make you a bad person if you want people to get into wrecks. But let's be honest, it's good for business. You know, I don't know any other way to put it. It feels dirty just saying it. I know, you know, I don't personally want to see them get hurt, but I'm here to help when they need me, and that's how I go about it. Same thing if it's icy outside, right? You don't want people falling and hurting themselves, certainly not breaking bones, but yeah, it's good for business. It just is. You get my drift. So we don't want 1/3 of the nation suffering from chronic pain, but that also means the opportunities that are open to evidence-based chiropractic, those opportunities are virtually limitless if we play our cards right. I can tell you that we have seen some referrals here in my office from a few of the pain doctors in the region, and these doctors are trying now to wean these patients off of opioids, and they're starting to look more and more for some alternatives to what they've been doing. And I want to tell you something. It ain't pretty. It ain't pretty at all. Some of these folks are mad as hell. They're mad at the world. Some are fidgety. They're all over the place. They can't sit still. Good Lord, I'm glad I don't prescribe. And I'm glad I'm not getting hit up all the time for these pain meds. That right there is that's a blessing all by itself, don't you think? Now, I'm an advocate of yours. I'm an advocate, okay? If you want to practice with adjustment only, hey man, go for it. I'm in your corner. If you want to integrate, go for it. That is awesome. I'm working towards integration. You know, I think that's wonderful news. If you want to further educate yourself, go for it. That's the American way. You ought to be able to practice and get reimbursed to the extent of your schooling and to the extent of your state scope. I'm all for it. There was actually a time I thought it might be kind of cool to actually prescribe myself, kind of like they do out in New Mexico. Chiropractors out there in New Mexico, they can go through an extra 2 years of education and have the ability and the right to prescribe some meds to their patients if they think that they need them. Now, I've had chiropractors tell me, well, Jeff, that's not chiropractic. And I get that. I do get that. And that is why it is called an advanced practitioner or something like that. I don't really remember right off the top of my head exactly what the official title was. But regardless, who am I to hold a brother or sister back that wants to further their education, further their rights, and further their capabilities? You did the work. You deserve the payoff. And I'm on your side about it. However, for me personally, I got to tell you, I'm over that. I am completely over it. Not only is research showing more and more that that sort of prescription and treatment basically has zero effect, no more effect than chiropractic, that's for sure. It doesn't have zero effect. It has no more effect than chiropractic. And on top of all that research, I don't want to have to deal with people looking for the meds. I got over that a long time ago. Now, in this article, the author goes on to mention the role of chiropractic, which she says are as follows, bold letters here, public awareness. We need to build knowledge on how chiropractic can help with chronic pain as an alternative to medications. And we've talked about this many times before here on Chiropractic Podcast. You're probably tired of hearing how we need to be educating people. We need to be informing other practitioners about chiropractic as a treatment option for patients. And this will become increasingly important given the recent focus on non-pharmacological care. Again, we've been screaming this one from the rooftops, so it ought to sound familiar at this point, shouldn't it? And we need to reduce misuse. We need to be helping patients locate drug drop boxes for opioid disposal, drug take-back programs, medication lock boxes, and testing programs. Now, this is one I haven't considered. We've never mentioned this once on this podcast. Not at all. And I think it's an excellent point. If you know how to commonly find these take-back programs and you know where these lock boxes are, send us an email at dr.williams@chiropractic4.com, and we're going to be glad to share that information with others. Right now, without going to Google for more information, I'm assuming you can probably call your local hospital and get this mystery solved, for your area, for yourself, for your people. That's why I'm guessing the hospital should know a little more about that stuff. Now, evidence-based chiropractic providers, you got to know this. You better get off your rears and you better take action on these points if we're going to take our place. You have to. Now next, there's this article in the Journal of the American Medical Association. It is titled, "The Burden of Opioid-Related Mortality in the United States." This was by Tara Gomez et al., published in JAMA in June of 2018. And here's why they did it. The authors wanted to answer the question, what has been the burden of opioid-related deaths in the United States over a recent 15-year period? Here's how they did it. The study was a cross-sectional design in which cross-sections were examined at different time points to investigate deaths from opioid-related causes from January 1st, 2001, all the way to December 31st of 2016. So that's a long time. That's a good sample. For the purposes of this study, opioid-related deaths were defined as those in which a prescription or illicit opioid contributed substantially to an individual's cause of death, as determined by death certificates. And here's what they found. Between 2001 and 2016, Between 2001 and 2016, the number of opioid-related deaths in the United States increased by, increased by 345%. From 9,489 deaths to 42,245 deaths. That is just outstanding. Overall, opioid-related deaths resulted in 1,681,359 years of life in 2016. I can't even wrap my head around that stuff. The numbers are so incredibly huge. So let's wrap up this paper here. This is what the author said. Premature death from opioids imposes an enormous and growing public health burden across the United States. Yeah, no kidding. We covered a paper some time ago that mentioned the average age of death has actually decreased in America in the last 2 years because of opioids, right? People aren't, the age estimate, right? People were living, I don't even remember what it was, 78, 79 years, I believe, something like that. Now our Americans are averaging living 76, something like 77 years. I don't remember the exact number. But our life expectancy is going down because of opioids. That's outstanding. Do you remember the uproar that Americans were in when we lost a little over 58,000 soldiers in the Vietnam War? Y'all remember that? Yeah. Another paper we reviewed here recently estimated over 64,000 deaths to opioids just last year. Right? Are we getting the picture? You see the issue? But chiropractors have been crazy all these years, right? We've been crazy to offer a sensible, safe, and reasonable alternative for treating these people. We've been treated as quacks and wackadoodles. Us. Give me a freaking break with that stuff, would you? Now, some chiropractors are crazy, okay? Some are crazy. Some chiropractors are crazy. Of course, some medical doctors are crazy, right? They are. These are facts, but evidence-based chiropractic care can fix this problem, and I have zero doubts about it. Now, I want to cover this next one briefly, just to highlight how damn tone-deaf these people in the medical kingdom can sometimes be. I'm surprised at this point this one's even getting published. But that's me. This one is called Prescription Drug Coverage for Treatment of Low Back Pain Among U.S. Medicaid, Medicare Advantage, and Commercial Insurers. Written by Dora Lynn, MHS. Not sure about that. And published in JAMA on June 22nd of 2018, so fairly recent stuff. This article, for me, really highlights the issue we're dealing with here in America. This is just June 22nd. Well, at this point, it's like 3 weeks ago. The question the authors looked to answer here was, among U.S. carriers, what are the coverage policies for pharmacologic treatments of low back pain? I'm not sure why we're looking at this. I'm just not. Okay, here's how they did it. A cross-sectional study of health plan documents from 15 Medicaid, 15 Medicare Advantage, and 20 commercial health plans in 2017 from 16 U.S. states representing more than half the U.S. population, and 20 interviews with more than 43 senior medical and pharmacy health plan executives from representative plans. They all sound so important and smart. They all do. Data analysis was conducted from April 2017 to January 2018. Of the 62 products examined, 30 were prescription opioids. We're still trying to figure out how to give out opioids. I don't know if y'all looked at that. 30 were prescription opioids, 32 were non-opioid analgesics, including 10 non-steroidal anti-inflammatory drugs, 10 antidepressants, 6 muscle relaxants, 2 topical analgesics, and 4 anticonvulsants. We just went over how gabapentin or gabapentinoids, anticonvulsants, were proven no good for low back pain, and that was in the Medical Journal for Canada. So scratch those off the list right off the top, okay? So here's what they find. Here's what they found in this article, okay? Look, okay, let's be honest. Who the hell cares what they found, okay? Who the hell cares? Here's why none of it even matters. None of this matters. This whole article is a waste of time. All they're doing here is trying to figure out what drugs insurers carry and how to get or cover and how to get drugs to people rather than what is effective, what the current guidelines recommend, what the Lancet papers had to say about opioids and non-opioids, what the American College of Physicians had to say is first-line treatment, and what's the last-line treatment for low back pain. I mean, none of that's even in there. How about they do a little research having to do with, I don't know, maybe doing away with opioids and anticonvulsants for low back pain, doing away with steroid shots and surgery for non-complicated low back pain, maybe knocking down the barriers to patients seeking alternative care. It's all crazy stuff, I know. Barriers that were noted and then called out by the White House last year, and barriers that were set up by the CMS and insurance companies. I mean, let's do some research into that stuff. How about we do something effective along those lines instead of wasting more time and paper? This could not be more exhausting. This week, I want you to go forward with comfort. Comfort in knowing that you are where you need to be and you're there for the right reasons. You're helping people stay away from these drugs. You're saving their lives. In many cases, you're absolutely saving their lives. Whether you know it or whether they know it, you're doing it. And we're saving them. And good on you. Keep it up. Keep making a difference. Stay with evidence-based chiropractic care. Be patient-centered rather than doctor-driven or numbers-driven. Don't be numbers-driven. The money will take care of itself when you're doing things for the right reasons. It will. Some of the key takeaways. Number one, opioids have not gone away. Clearly, pill pushers haven't gotten the message yet. The issues are still there and they're real. Number two, research doesn't matter unless we educate the medical professionals around us about the research and educate our patients about the research. So spend some extra time talking to these folks. Talk to your patients about this stuff that we go through, the stuff that we cover here on the Chiropractic Forward podcast. Use it. Don't just listen to it. Take it and use it. I want you to know with absolute certainty that when chiropractic is at its best, you can't beat the risk versus reward ratio. You just can't, because spinal pain is a mechanical pain. And it responds better to mechanical treatment rather than chemical treatments. The literature is clear. Research and experience show that in 80 to 90% of headaches and neck and back pain, patients get good to excellent results when compared to usual medical compare. And it's safe, less expensive, and decreases chances of surgery and disability. It's done conservatively and non-surgically, with little time requirement or hassle on the part of the patient. And if done preventatively going forward, we can likely keep it that way while raising the overall level of health. At the end of the day, patients have the right to the best treatment, doing the least harm, and that's chiropractic, folks. It just is. Send us an email at dr.williams@chiropractic4.com. Let us know what you think of our show, or tell us your suggestions for future episodes. We want to know. Feedback and constructive criticism is a blessing. So are subscribes, excellent reviews on iTunes, come on, and other podcast services. Help us out. Y'all know how this works by now. So if you don't mind taking a few seconds, we'd appreciate it. Being the #1 chiropractic podcast in the world, oh, that'd be pretty darn cool, wouldn't it? We can't wait to connect again with you next week. From the Chiropractic Forward podcast, Flight Deck, this is Dr. Jeff Williams saying upward, onward, and forward. Be sure to find me on social media sites such as Facebook, Twitter, LinkedIn, And YouTube, while you're at it, give us a thumbs up on YouTube. That's super simple. Be sure and visit chiropractic4.com. Give our podcast a listen. Lots of wonderful, wonderful information there. And as always, thanks for listening. We'll see you next time.